Hi, I am Dr. Samir Ahire. I am a board certified cosmetic and plastic surgeon. I do practice in Mumbai and Goa. Welcome to our channel, which is Evolve Cosmetic Clinic. And in today's video, I am going to tell you what are the different options, pockets available for putting a breast implant. So, if you are thinking of getting a breast implant surgery done and you are confused whether to go ahead with a submuscular, subfacial, or any other pocket, this video will clear all your doubts. So, let's start with today's video. To enlist a few, what are the different pockets available: glandular, subglandular, subfacial, submuscular, dual. Traditionally, people used to put implants in glandular, subglandular, subfacial, submuscular, or dual plane. But these days, we do prefer putting implants in only two pockets. First is a submuscular pocket, and second is a subfacial pocket. So, in today's video, I'm going to tell you what actually happens in putting the implant in this pocket, what are the pros, what are the cons, and which pocket should you prefer. Let's start with submuscular. Submuscular pocket means what? There is a pectoralis muscle present. We do put the implant below this muscle. If you are skinny, you are not having good thickness of breast, plus to that you want to hide your implants, you are having a high riding breast, there is no sagging present, then you can go for the submuscular pocket. Submuscular pocket advantages are it is a kind of a safety pocket in which you have the muscle above your pocket, so your implant has an extra layer over it and which gives it a protection. The second advantage is the chances of capsular contraction is less in this pocket as compared to other pockets. What are the disadvantages of putting an implant in a submuscular is a long recovery period. Since the implant is below your muscle, it will take some time for your muscle to relax for your implant to take the shape. Second is distortion of the animation or the contour of the implant. Since the muscle is going to be above your implant, whenever you are going to feel the implant, you are going to feel breast, muscle, and then the implant. So you won't be directly feeling the implant, you will be feeling the muscle first. And because of this, there can be some distortion in the shape of the implant. It won't be completely round, it might be little bit taut in the upper part, little bit soft in the lower area, and it won't give you a fuller shape in submuscular things. So these are the things to consider when you are going for a submuscular pocket. The next is a subfacial pocket. Subfacial pocket is what? It's above the muscle but below the gland. There is a fascia present over the muscle. We put the implant in this pocket by creating a subfacial pocket. The advantages of subfacial pocket is it gives a faster recovery, faster results. It gives a very beautiful, fuller breast, good shape. Disadvantages: chances of capsular contractions is a little bit high as compared to the submuscular pocket, but still we have noticed if you put it under the fascia, the chances of you having capsular contraction is very nominal or very minimal. Who are the patients who can go for a subfacial pocket implant placement is patients who have sagging, who have fuller breast, who have good amount of breast tissue, and these days it gives advantages of glandular as well as submuscular pocket, plus it doesn't give you the disadvantages which are faced with the glandular placement and the submuscular. So this was in short regarding the subfacial and the submuscular thing. These days I do prefer going through an inframammary approach, and I do put the implants in subfacial because most of my patients want a fuller, good shaped breast, and the chances of recovery is also very fast. Plus to that, what I have observed in my practice is subfacial breast implant placement gives excellent results, and this is the most preferred pocket by me these days. So if you are thinking of getting a breast implant done and you are confused regarding details or what are the things associated with breast implants, you can come to our channel, like this video. You will get more and more videos regarding breast implant silicone surgery, so that you can clear up your mind and come for the procedure. If you are having any questions, queries, put it in the comment box. My team will get in touch with you. Thank you.